Hello, everyone, and welcome to the Healthy Living live stream. I'm your host, Dr. Andrew Kaufman. Today, we are going to talk about the healing benefits of cilantro. But before I get started, I'd like to announce to everyone that my shop will be having a surprise sale sometime very, very soon. And if you'd like to take advantage of that, including a discount on my Spagyric Cilantro tincture, the subject of today's live stream, please follow the link to sign up for my newsletter, and then you'll be among the first to know when the sale breaks. Okay, thank you, everyone. So today I am talking about cilantro, the herb that you may know as a culinary herb, and it does have different names because it's also known as coriander. And this nomenclature varies geographically, but also coriander often refers to the seeds of the plant, whereas cilantro refers to the leaves and stems. So there's a little bit of confusion about this, but I'm going to talk about many studies today, which all use various parts of the plant. Now, this plant you know about because of its culinary use as a flavoring in a variety of dishes from different cultures, especially from near Asia, but also in Latin America. And it's become kind of a common ingredient in our cooking. But what you may not know is that also traditionally this has been used as a medicinal herb in many cultures across Asia. And if we can bring up the first slide here, this is a summary from a review article of various traditional uses from different countries in Asia predominantly. So, for example, it's used for joint inflammation and rheumatism in India. In China, used for measles, diabetes, and various intestinal or stomach problems. And you can see that both the seeds, the whole plant, the leaves, and various preparations are used depending on the region and the particular indication. Now, interestingly, it talks about Pakistani herbal drugs or traditional Pakistani medicine and says it's an antiviral. However, I don't think they had any concept of viruses in Pakistani traditional medicine, but also as a neuroenergizer, and that sounds a little bit more authentic. But what they probably mean is that it was used for acute seasonal illnesses. Now, it was also used for some liver diseases, but you'll find a more common theme among traditional uses that it applies to the kidneys specifically, and I'll present some research data to explain why that is. In Iran, it's listed as a carminative, and you'll see many different cultures used it, and that's essentially for flatulence. Also as a diuretic, which increases the excretion through the kidneys, other GI type of symptoms, and convulsions. And we will find some evidence in the medical literature also about its properties as an anti-seizure medication. And then it lists insomnia and anxiety, and you'll see that depression and anxiety are other indications in various traditional uses. So in Morocco, it's been applied to kidney diseases and as a diuretic. Also in India, it's been used for melancholia, and it's used in tobacco and perfumes as an aromatic, in addition to the ground up coriander seeds in curries. And also, you'll see a theme that it's used a lot for diabetes-related issues. So lowering blood sugar levels in Saudi Arabia, Jordan, and Morocco. And I think that probably predates the blood test for sugar. So it's probably to treat the symptoms of diabetes, which are excessive thirst, hunger, and urination. And we see similar indications in traditional Chinese medicine for acute illnesses, bad breath, unpleasant odor from the genitals. That's an interesting one. Worms is mentioned here, also rheumatism in the European pharmacopoeia, and some more GI stuff throughout Asia. So we can see several themes here in how this herb was used in traditional forms of medicine. Now, if we go to the next slide, this is from a different review article that looks at all of the therapeutic indications based on more modern scientific studies. So not based on tradition, but based on published research studies, and almost exclusively with animals. But we can see here different categories. So on the top left, we see that it prevents oxidative damage. And there's quite a lot of studies demonstrating that. And I'll highlight a couple of them as I go through. Now, this paper also talks about linalool, which is one of the terpenes that's in the cilantro plant, and it's in many other things. In fact, there's some of it in turpentine as well, but I'm not going to look at that. I want to look specifically at the cilantro plant here as a whole, because that is the natural element. So in addition to the antioxidant effect, you'll see that it inhibits microbial growth. And I don't think that this is through any direct effect on the microbes. It's probably because it can chelate the toxic material that the microbes are trying to clean up, and then they're no longer needed. Also in diabetes, it has been shown to decrease fasting blood sugar, also to prevent glycation of proteins, which is attaching sugars and then cross-linking them to proteins. And if you're familiar with the diagnostic test, the hemoglobin A1C, that's what it's measuring. It's measuring the glycation, or the adding sugar to the hemoglobin protein. And then other effects as far as liver metabolism of sugar, which have all been positive, as well as decreasing excretion in the urine of blood sugar, and decreasing the blood sugar levels after meals. So this has been thoroughly tested in animals to have a variety of therapeutic effects for diabetes. Now, there are also some studies of rats where it's shown to improve memory and learning, and I'll highlight one of those. Alleviating anxiety. Now, that's a little bit more difficult to draw analogies from animals, but in terms of neurologic disease, that there is some impressive data on oxidative stress in the brain and cognitive performance. And then there's at least one study as an analgesic for pain relief. So now this didn't even describe the cardiovascular benefits, of which I will show some studies. So at this point, you may be asking yourself, if there's all of this traditional use of the substance for a variety of indications, and we see a lot of patterns where multiple different cultures used it for the same issue, and then we see scientific studies of mostly animals, one human study looking at skin fungal infections, which also was beneficial, but showing basically that it backs up many of the traditional uses and shows some impressive therapeutic potential. You would think that this would be something that, one, there would be a huge amount of research looking at human illness and perhaps veterinary illness because of the vast therapeutic potential. And then also that we would expect doctors to know about this, and that this would be one of the things that they could easily recommend to people. But as you know, that is certainly not the case. In fact, when I was practicing medicine, I never, ever heard of cilantro mentioned in any context other than, do you want some in your salsa? So if we put up the next slide, here we can see some of the propaganda. Now, this is from USA Today, and I came across this by accident, but I was actually familiar with the studies that it cited, and didn't think that it was telling the full story. So you could see from the title of this article, fact check, right, as if there's misinformation, claim that cilantro removes heavy metals from the brain is unproven. And that is the conclusion of the article. However, right in the text, you can see the highlighting portion where it mentioned two specific studies of lead in the brain of animals. And it said in the first study that rather than whether cilantro can remove heavy metals, so in other words, they say the study didn't report on that. And in the other study, it says it did not address whether cilantro removes heavy metals directly from the brain. Now, I'm going to fact check the fact check here. And if we go to the next slide, this is the first study that was referenced. And, I clicked on that link to make sure it was the same study I already had. And it was. And you can see in the highlighted portions, the top three categories on the right, the top two, sorry, that are highlighted. The first one is reactive oxygen species. And you can see that there is a significant reduction, and CST1 and CST2 are the groups that had the treatment with cilantro at different doses, and the CST2 had a higher dose. Now on the left, you can see the control group numbers, the raw numbers, but these highlighted numbers are actually the percent change from the control situation. So in other words, they gave these rats exposure to lead, and then they measured the level of lead in some of the rats. Then they split them into groups and gave them the cilantro at different doses, and then they measured the same parameters. So you can see that with reactive oxygen species, there was a 10 to 25% reduction depending on what part of the brain. So that's an indication of a reduction of oxidative damage. Same thing with LPP, that's lipid peroxidation products. So that's oxidation of fats in the brain, also reduced by a higher magnitude. But if we go down to the bottom right, that is the levels of lead in the brain. So they actually did measure brain lead levels. And you could see in the group with the higher dose that the levels of lead were reduced by 31.3% all the way up to almost 72%. So this actually does confirm that cilantro does remove lead from the brain. Now, if we go to the next quoted study on the next slide, that's more recent, we have similar findings. So you can see from these two graphs that the one on the left are the blood lead levels, and the one on the right is the brain lead levels. And you could see that the group that got lead has the high graph in the third column, and the graph on the right were the group who got lead and cilantro. So once again, there was something like a 60 to 75% reduction in the brain lead levels. So this study as well clearly demonstrated that cilantro does reduce the level of heavy metals in the brain, specifically lead. And if we look at the next slide from the same study, this shows the different antioxidant enzymes that are native in our bodies, and it shows the amount of oxidation. So if we look at the top left, that is an assay for the amount of oxidative damage. And you can see that the bar on the far right is lead plus cilantro, and the one to the left of it is just lead. So it's significantly reduced the oxidative damage. And the other three graphs show various antioxidant enzymes. So SOD is superoxide dismutase, for example, and cilantro caused an upregulation of all of those enzymes. So cilantro itself may have direct antioxidant properties from various compounds in it, but it also induces or increases the level of the native antioxidant proteins in the body to further reduce the oxidative damage. And this is borne out by additional studies, both of these findings, that the metals are reduced and the oxidative damage is reduced. So if we go to the next study, which is also on lead. Now, in this study, they were looking at the distribution of lead in the body because it can often go to the bone, and similarly to the way calcium does. So they gave the lead and then they looked all over the body to see where it turned up. Then they gave Chinese parsley, they call it here, or cilantro, to the animals. And what they said in the abstract is these results suggest that Chinese parsley has suppressive activity on lead deposition, probably resulting from the chelation of lead by some substances contained in Chinese parsley. So this would be the same proposed mechanism by which the lead was removed from the brain in the two other experiments. Now, in this experiment, they also used a pharmaceutical chelating agent to compare the results, and that is DMSA. So you could see in that middle table the statistically significant findings that the lead deposition in the bone was substantially reduced, especially in a dose-dependent fashion with the parsley, and the numbers were somewhat similar to the pharmaceutical intervention. And what is really impressive about this study is that they also looked at some of the oxidative damage from the lead poisoning that they induced on these rats. And they specifically looked in the kidneys, where they found a variety of types of damage that were visible on the microscopic sections. But if we read the highlighted portion at the bottom of this slide, in the group administered Chinese parsley at 12 milligrams, that's the higher dose, or DMSA, the pharmaceutical chelating agent, the destruction of the brush border, swelling of the proximal tubules, and protein-like substances in the proximal tubules were rarely observed. So in other words, the kidney damage that they saw when they just gave lead was completely reversed when they gave it with cilantro. So that's very impressive, because it's one thing to do an assay showing that there's reduced oxidation, but it's a totally different and much more meaningful thing to show that in the organ itself, there's no tissue damage. Okay, so we continue on with the kidney with the next study, and this one uses a leaf extract, and it looks, instead of lead, it's looking at arsenic and cadmium. Now, it's very, very difficult to find studies with natural chelators like cilantro and zeolite and bentonite clay and horsetail and other natural materials that address all different kinds of metals. They usually only a couple that you can find studies. So there aren't very many with arsenic and cadmium, and these are, especially arsenic, is probably more commonly present toxin in our bodies than we might think. So I'm glad they did this study. And they essentially had very similar findings to the lead studies. And it states here, the present study indicates that intake of coriander leaf extract contributes to powerful resistance to oxidative stress in the kidney, probably via decreased concentrations in heavy metals. But they don't know that it also induces the native antioxidant enzymes. It's likely that a decrease in arsenic concentration to the detection limit is a major factor. Okay, so if we look at the next slide, this shows the levels of the different metals, and they also looked at iron, zinc, and copper in this, which are, they can be toxic at high levels, but they're also essential minerals. And we can see that all of the bars that have asterisks on them are statistically significant. So we can see that the arsenic level is so low in the treated group that it's undetectable. And we can see the cadmium is reduced by about half, and that's significant. Now, the iron and zinc are also reduced. The zinc is not a significant reduction statistically, and the iron, I don't believe, is problematic. I don't think that your entire iron stores in your body will be reduced from this, and there's no evidence of iron deficiency, anemia, or anything like that in any of these studies. And sometimes they administered the preparations for up to 120 days. So it's not like they just gave one dose or anything like that. So I think if we go to the one more slide from that study, the next slide, we can look here at a assay using a fluorescent stain to look at reactive oxygen species. And the top two panels are at the baseline, so at the beginning of treatment, and you can see that there's pretty comparable degrees of fluorescence, which represents the reactive oxygen species. But then after the coriander was administered, you can see that there's a major reduction in fluorescence, and that's the dark slide on the bottom right. So if we summarize what we have so far, is I presented several studies looking at heavy metal toxicity and organ damage in several animal models, and we've seen the same results in every study. That one, the levels of the heavy metal in various organs and tissues are reduced. There's reduced levels of reactive oxygen species and oxidative stress, and there's actually decreased damage or reversal of damage to the end organ. So quite impressive findings in these animal studies. So I'd like to move on and cover the next topic of therapeutic benefit for cilantro that's been well documented in the literature, which is related to cardiovascular disease. So if we can bring up the next slide. Now here they had a special model of albino rabbits that have this high blood fat situation, and they gave them a high fat diet. Now it's important to remember here that the natural food source for rabbits is that they're herbivores. So they eat, grasses and lettuces and leaves and things like that. So giving them a high fat diet is completely not their native diet. And what happens is that they develop atherosclerotic lesions in their arteries. So I'm going to read a couple of quotes from this study. It is also observed that there was drastic reduction in the level of lipid peroxidation. So once again, we see the antioxidant effects here in the vascular system rather than in the kidneys or the brain or other organs. And the plant extracts also significantly prevented the atheromatic changes and plaque formation in the aorta. So we can actually visually look at those on the next slide. And these are cross sections of the wall of the ascending aorta in these rats. And the top left is the control rabbit that was not fed the high fat atherogenic diet. And the three panels in the middle represent them being on that diet without treatment for various lengths of time. And you can see the thickening of the artery wall and the development of these plaque lesions that kind of look like semicircular lunar shapes that are superimposed on the wall of the artery. Now, on the bottom two panels are the two different groups treated with cilantro, on the left for 60 days and on the right for 120 days. And you can see that those arterial specimens appear almost normal, just a few thin layer of some foam cells, which are probably cleaning up the damage there, but no plaque lesions whatsoever. Now, if we go to the next study, very similar, and this one was in rats instead of rabbits, and they were also given a special kind of high fat, high cholesterol diet. In the highlighted portion, co-supplementation of Coriandrum sativum, which is the Latin name for coriander, to atherogenic rats recorded significant lowering of the above mentioned parameters, further strengthening the claim that coriander extract is instrumental in preventing onset and progression of atherosclerosis. And on the next slide, we can once again see the stained images here. This is of the thoracic aorta as well. And the normal controls are the top two panels. And then you can see the bottom two are with cilantro, and the middle two are the ones that didn't get cilantro. So you can see in the middle two, from top to bottom, all the damage. Now the stain on the right shows calcification. So you can see the entire lining of that artery is filled with calcifications, which is kind of evidence of a damage and repair, whereas there's only very small calcifications that perhaps if this diet went on a little longer, you would not see them. So once again, no plaques on the arteries treated with cilantro. So here we have two separate studies in two animal models that both show an inhibition of plaque formation in the arteries. So very impressive. And there's one more cardiac study I'm going to point out on the next slide. And this actually looked at arrhythmias in rats. And what they did is, in these experimental rats, they used drugs to initiate both a tachyarrhythmia, where the heart rate is too fast, and a bradyarrhythmia, where the heart rate is too slow. And then they administered the standard drugs for those conditions in one group, and they administered cilantro in the other group. And here's what they found. The anti-tachycardial potential of coriander was comparable with standard drugs. So, and that standard drug was propranolol, a beta blocker. So they're saying that cilantro is as good as a beta blocker for tachyarrhythmias. And it was almost as good for slow heart rate bradycardia as the standard drug atropine, but was a little bit slower in its onset of action. And they concluded that treatments of rats with coriandrum sativum, and they gave a dose, normalized the heart rate and attenuated the cardiac arrhythmia. So this is excellent because there aren't very many natural substances known to have antiarrhythmic properties. And among pharmaceuticals, you almost never have one substance that can reverse both a tachy and a bradyarrhythmia. So this is quite unique, and should be a marvel that pharmacologists want to emulate and study further, but unfortunately it's not. So let me summarize then briefly for you what we learned. So first we talked about heavy metal toxicity. Now I presented 3 animal studies looking at various types of cardiovascular pathology. We've seen 2 studies where administration of cilantro can prevent the development of atherosclerotic plaques, which are associated with all kinds of vascular disease, heart attacks, strokes, peripheral vascular disease, bowel ischemia, etc., successfully in 2 studies. And then we saw 1 study where it can act as an antiarrhythmic, both in rapid and slow arrhythmias, which is really unheard of in cardiovascular medicine. So let me mention one final article in a different area, and this has to do with cognitive performance, so neurologic situation. And here we have the leaves being used in experimental animals to test their memory scores, and as well as some molecular tests. And they did this, by using mazes and things like that. And they found that memory improved by administering cilantro. So this is certainly very promising. I'm not saying that you should be taking a few drops before your next exam, but this is, a very exciting that there are therapeutic potential related to perhaps neurodegenerative disease that affects cognition, such as dementia. And further indication that this may be the case is because there's quite a large body of evidence implicating aluminum as a causal factor of dementia. So we know, because cilantro has a high silica content and has been shown to be able to remove heavy metals, that perhaps it can bind aluminum and remove it from the nervous system. And that could be an additional mechanism where it could be useful as a therapeutic for dementia. So today I've discussed quite a number of really impressive studies on the herb cilantro and the various parts of the plant. And it seems like no matter what part of the plant you use, you get similar beneficial outcomes. And many of these benefits seem to be related or potentially related to its antioxidant properties, which occur through direct activity and also through induction of the native antioxidant enzymes in our bodies. And we see that in multiple organ systems and situations, that it can prevent and reverse end organ damage from a variety of causes, including in cardiovascular disease, metabolic disease, and heavy metal toxicity. and possibly neurotoxicity. So it's quite an impressive herb. Of course, it can't be sold at the same kind of profit as pharmaceuticals. So it's been largely ignored by the pharmaceutical, medical, industrial complex, and even suppressed through various types of propaganda. But if we go and look at the primary evidence ourselves, we can see how impressive it is, and also realize that there's very little risk with using this herb. You have to ingest massive quantities to get any significant toxicity. So hopefully this is a very informative presentation, and I would be happy to address some questions.
All right, well done, Andy. It was a great presentation. If you guys have any questions, please write them down in the comments, and then I'll add them in. I'll go through them and collect them on the fly, and then I'll showcase them on the screen. Now, let's go to the first one from Lizzie. Can cilantro fix root cause of atrial fibrillation? Does it repair does it repair the electrical system of the heart?
Well, I think it's important to note that no substance actually fixes anything in our body. Our bodies are the only entity which takes action to repair damage, injuries, dead cells, etc. So any natural material that may have therapeutic benefit essentially complements the body's repair mechanisms, or perhaps induces a desired response from the body. Like we saw a direct example of this in the research, where the cilantro stimulates the body to produce more antioxidant enzymes, right? So it's important to know that our body is what does the repair. Now, we don't have, data to say that you can take cilantro and your atrial fibrillation will completely revert back to a normal rhythm. But I do think that there's a lot of promise, and it would be pretty easy to try this approach for a period of several weeks and monitor the situation. You could even use a Holter monitor, but you can probably just detect by your pulse, or even just by feeling it internally, when you're in AFib, if it's an intermittent. And if it's chronic, then it'd be much easier to monitor if you convert back to a normal rhythm. But I think what I would do is, if I had a consultation where I was asked about this question, is I would probably try to find evidence of what might be the root cause. Is there a specific toxin, or are there other heart issues? And then try to address that underlying cause with some kind of protocol, and perhaps that cilantro would be a part of that. Like, for example, let's say that there was a heavy metal infiltration into the heart, then attacking it with multiple chelating agents which have similar evidence, things like zeolite and saunas that induce sweating, would be an excellent, more comprehensive approach.
All right, another question from Danny Golf. Is there any reliable test to determine if you have high concentrations of heavy metals in your body?
All right. Well, it's nice to hear from you, Danny. And that's an excellent question. I think you know what I'm going to say, which is that no, there isn't. And in fact, this is kind of highlighted in one of the studies that I mentioned, where they look at the levels of lead in the blood versus the bone. And you could see that the levels in the blood were really the same in the group that was getting cilantro as it was in the control group, even though the amount in the femur was much different than the amount in the kidneys. So blood is not going to give you an accurate representation. And this is going to be the same thing with urine, and the same thing with hair, because the body tends to store things in different parts, in different compartments. And there's not one area that you can sample that represents the distribution throughout the body, because the distribution can be quite different. So one substance, for example, I've talked recently about fat-soluble toxins, and those are stored principally in the fat and in very fatty organs. So in the adipose tissue, in the fat that's around the visceral organs, or and in the central nervous system, but not necessarily in other parts of the body. So if it's sequestered in those places, it won't necessarily show up in the blood. So you have to really do some kind of detective work to figure out if heavy metals are the problem. And part of that is by how it's being expressed in your body. There are certain patterns of expression that and of illness that tend to go with heavy metal toxicities, and sometimes it's kind of a process of elimination. So I wish there were a reliable test, but unfortunately, there are all kinds of limitations to this type of approach.
All right. Great answer. We have another question from Del Barton, Mom 2008. Can consistent use of cilantro heal or greatly mitigate COPD? And I think the answer will resemble the answer to the first question pretty much.
Right. Well, certainly there is a bit of a sense of cilantro as a panacea, because pretty much all of the scientific studies that it's been looked at and tested for various clinical conditions have shown a very good response and a lot of promise. Unfortunately, I'm not aware of any studies that look specifically at any kind of lung disease, including COPD. But I think that, it's something that you could attempt and then see if you realize any improvement. But on the other hand, turpentine has been studied for COPD and has been shown to be quite effective, not only in the airway issues, but also in pulmonary hypertension by reducing it, which is something that no pharmaceutical has been shown to be able to achieve. And this was done in baths of turpentine, actually, where turpentine at various levels was mixed with water and the dose was increased as they did these baths every day. And I think it's very similar to doing steam inhalations of turpentine. So on my website, you'll see that there is a free webinar, Avoiding the Emergency Department, and affiliated with that is a document that describes that procedure that you can get to address COPD. Or I certainly would recommend a consultation to get a more full protocol, but that is a condition that definitely can be reversed.
All right. Last question from Carolyn. I've been using your Spagyric Cilantro as directed. Do you recommend this for regular daily maintenance, or can you overuse it?
Well, anything can be overused, and everything is toxic at a certain dose. So the cilantro is really meant for time-limited use to address a specific issue, but this could be, done periodically as part of your, annual or semi-annual detox regimen, or you can do a course of it for, up to 12 months if you're continuing to get a benefit. Like, for example, many people that do have heavy metal toxicity, it can take quite a bit of time to get all the metals out of your body. Like, even we saw in those studies, even though some of them were up to 120 days long, the amount of lead or other metals they found in the tissue didn't go to zero, except for the arsenic in that one study. So it may require, 6 to 12 months of chelation therapy to fully get rid of heavy metals, for example. And I suspect that also for arrhythmias, a little more prolonged treatment would be in order. So I think it depends on what you're using it for, but it would certainly be safe at a minimum for up to 12 months of continuous use.
All right. Very interesting presentation, Andy, and well done answering the questions. It's a very fascinating topic. Do you have any final remarks before we close off the stream?
Well, I do really enjoy when nature proves its worth, under scientific scrutiny. So this was a pleasure presenting on this topic. And anyone is interested in getting yourself some cilantro tincture at a discount, please do sign up for my email list. And of course, you'll also get reminders about what topic that I will be speaking about on the next Healthy Living live stream. So we'll see everyone next week.
Take care, everybody. Cheers.